stop spinal stenosis from progressing? Now, back pains are a very common phenomena in the working population and more so with working moms as we juggle kids, home, work, travel, meetings. I mean, the list is endless, right? So, back pain is not very uncommon with working moms. And one of the common reasons for back pain and neck pain actually is spinal stenosis. So, when I say spinal stenosis, I'm referring to either back or neck. Now, w- one of the main questions that comes with spinal stenosis is, can I stop the progression of spinal stenosis? So let's look at this, look at the answer to this question in this video. Now, before I jump into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs manage their spinal, that is back and neck, and joint pains. Now, as mums, we are busy. We usually pressed for time. Well, always pressed for time. And we don't have a big chunk of time to take out for managing our spinal and joint pain. And this is where I come in. I help you understand why and what and the reasons behind your spinal and joint pain. And I give you simple exercises, easy lifestyle changes, hacks, tips, tricks, etc., that you can manage within your existing time frame, and you don't have to take out extra time to do these little changes or these exercises. So let's jump back into the topic for today, and that is, can you stop spinal stenosis from progressing? Now, if you're not sure about what is spinal stenosis, you can go to my YouTube channel, and I have done detailed videos about what is spinal stenosis, what are the types of spinal stenosis, how can you, what are the symptoms, as in what does a spinal stenosis feel like? So you could either go to my YouTube channel, or you can go to YouTube, type my name, Swati Prakash, followed by spinal stenosis, and the videos will come up for you. Now, just to tell you briefly, spinal stenosis is narrowing. So if there is a narrowing in your spine, that is basically known as a spinal stenosis. Now, it can happen in two areas. One is in the spinal canal. So basically, the canal between, you have the vertebrae stacked on top of each other, and on the, if you look at somebody's spine from behind, there is like a canal or basically a hollow area at the back of the vertebrae that sort of lines up, and your spinal cord is passing through that. And as you know, the spinal cord will control the sensation and all the nerves and everything, right from your cervical spine here, from your hairline down to where your about your lumbar spine is sitting. So if you have a stenosis, that is a narrowing in that area of the spinal cord, there's going to be an irritation or compression of your spinal cord. Also, stenosis can happen on the side joints of the vertebra. So between every two vertebrae on the side, there is a joint known as a facet joint, and that is exactly where the nerves from the spinal cord are exiting. Now, if there is a stenosis there, it's known as a foraminal stenosis. However, let's not get into the details of this. Let's jump into what does spinal stenosis actually feel like in and what happens with spinal stenosis is, obviously, if, okay, let's consider the example of spinal stenosis in your lumbar spine. Now, the same is applicable for your neck, but your symptoms will be more, if you have nerve irritation, which usually happens with stenosis, the symptoms will be more in the arms and hands when it comes to your neck. However, let's look at the lumbar spine for now. So in your lumbar spine, if you have a spinal stenosis either centrally or on the sides in the foraminal area, you will have obviously back pain. However, you will also, most probably, you will have tingling, numbness, or weakness in your legs. Depending on which nerve is irritated or pinched, that area of the leg or your bottom or your thigh will be affected. So just looking at my notes here, yeah, so this is basically a nerve pain. You can again look up the details of nerve pain on my YouTube. So you will have a nervy kind of pain. However, one of the classic signs is that when you stand for a long period of time or you walk for a long period of time, especially when you're going uphill, or if you're one of those when you're going downhill, you're trying to push your back into extension, that is bending a little backwards, you will have pain, and you will have this pain or cramping in your legs. That is known as a neurological claudication. However, you don't need to get into the details of the terms. You will know if you have spinal stenosis, you know what I'm talking about. So, now coming to the question of can you stop spinal stenosis from progressing? It is not possible to stop spinal stenosis from progressing, sadly. However, it is possible for you to slow down that process or for it to take a temporary or, well, a permanent pause. Nobody can predict or give you a guarantee of it's not going to progress. However, you can try your best. Now, you cannot do much about the stenosis that has happened in the area. You can, of course, work on, say, if it's a disc problem that's causing your stenosis, then what you can do is work towards healing that disc, right? So you basically, whatever is the cause of the stenosis, you can work towards managing that cause. But apart from that, what you can do is you can work on strengthening your back, but then not just going to the gym and doing a deadlift to strengthen your back, but manageable exercises in the pain free range so that it doesn't aggravate your back pain. So you can do exercises to strengthen your back, mainly exercises to strengthen your core muscles, because the core muscles are the one that are at the deepest layer of muscles. So once they are strong, they will stabilize your spine, and then these bigger muscles, you're going to strengthen them, and you will have much more stability in your spine. Plus, if you have a poor posture, you can make sure that you are sitting in a good posture. You are basically not adding on to the stresses on your spine. If you have a lot of inflammation and pain, then going in for a more anti-inflammatory diet, and taking care of the inflammation in the body. And this is all, of course, apart from medication that I'm talking about. um, yeah, so if you are looking for simple solutions to manage your back pain, this is something that I have addressed in a free training in my community. It is a free community. I will leave a link in the description of the video. You can join from there. If you're watching me on Instagram, the link is in the bio. So where you have my picture, you'll have like a link there. So you can join my community from there. And in my community, I have also done free trainings on simple solutions to manage your neck pain, your nerve pain. There is one unit on how you can correct your posture. So there is a lot of information in there which can help you with your spinal stenosis, whether it is in your neck or it is in your back. So I hope you find it useful. And if you're looking for more to do with how do I manage the inflammation in my spine, you can also message me and I will let you know more about that. Alrighty, if you have any questions, any comments on this video, please drop them below this video and I will pick it up from the comments. Alrighty, I'll see you guys next time.